Last chapter, 81st difficult issue. Still talking about tonify reducing. But we talking about excessive condition we need reducing. Deficiency condition we need tonify. But if we use wrong, what will be happens? So that's basically in this chapter 81st, we discussed. So all they talk about scripture status. Just means Huangdi Neijing talk, discuss. Just means in Huangdi Neijing, that book they talk about, they mentioned, mentioned. We say Nan Jing gave a lot of explanations for Huangdi Neijing. So that's in Huangdi Neijing they talking about. So Huangdi Neijing, what they talking about? They say don't tonify excessive condition. And don't reducing a deficiency condition. And don't reducing some weakness condition. If we do this way, we will make it more deficiency for deficiency condition and make more excessive for excessive condition. So that's in Neijing mentions, deficiency we need to tonify, excessive we need reducing. So the question here, so talking about deficiency or excessive, if we're talking about the pulse condition, pulse in 寸口, 寸口 pulse, just generally we feel the pulse location around the lung channel, like between lung 7, 8, 9 in there. That's the 寸口 pulse, 寸口 pulse. 寸 is the same 寸关指. 口 is open, open. So in that area, look like a open area, we can feel the internally or body qi levels. So that's why they call 寸口, 寸口. So when we're talking about deficiency or excessive, if we're talking about the pulse, 寸口 pulse deficiency or excessive, or we mentions illness deficiency or excessive. So that's one question in here. One question in here. You can put these two lines together, form one question. And the second question, second question is if it is wrong, means we talked about before, deficiency we need to tonify, excessive we need to reduce it. If we make it wrong, like a deficiency we reduce it, excessive we tonify, what will be happens? So that's the second question. That's the second question. So the explanation here. So we're talking about deficiency and excessive. We're talking about illness. We are not talking about the pulse. Certainly, most case, we say most case, pulse will be matching with the illness. But special kind of condition, like we talking about, especially sometimes tracking blocked, that's excessive condition, maybe also blocking the pulse. You feel the pulse look like a deficiency. So that's why we're talking about illness. We are not talking about the pulse here. Yeah, we follow the pulse. We follow the illness. Yeah, we are not follow pulse. We follow the illness. So if illness excessive, we reducing it. If illness deficiency, we tonify it. So we follow the illness. Then they give us examples. So they give us an example like liver excessive and lung deficiency. So liver relationship with the wood, lung relationship with the metal. In one chapter before, we talking about the balanced metal and the wood kind of balance there. Like a husband and a wife, one is softer, one is harder. So they will be balance each other. And truly, if we think about 5 elements, the metal control the wood, wood able to insulting for the metal. So basically they can keep the balance there. Is no trouble there. So now we're talking about excessive in the liver. Yeah, excessive in the liver. And deficiency in the metal. So that we should tonify the metal. And reducing for the liver. So that's we say tonify when they have deficiency and reducing when they have excessive. So in this way, they will balance each other. And they give us another examples. Another example is opposite. When excessive happens in the lung and the deficiency happens in the liver, and in this kind of case, if we are not tonify the liver, we still tonify the lung. That will cause the liver weaker, more weaker, and the excessive lung is more excessive in there. So that's cause the patient's trouble. So that's the they put a middle doctor here. I would like to say infant doctors. Yeah, infant doctors make this kind of mistake. That will cause severe kind of damage for the people. So like this chapter just gave us 2 examples talking about excessive condition and deficiency condition. So truly we need to tonify for deficiency, reducing for excessive. If we do something wrong, that will cause the patient's illness more severe and even go to pretty dangerous situations. So that's the last chapter in Nan Jing. That's the 81st chapter, difficult issue.